Well, we're a full-service plastic surgery practice. We do all types of cosmetic surgery as well as skin care and a lot of other things.
Patient education is a huge part of the patient's experience here at the Advanced Plastic Surgery Center. When people come into the office, they have certain expectations and they've gotten information from the internet or from the TV or things, and it's part of our job to educate them to what is a realistic expectation and to what their experience is going to be like.
Breast augmentation or breast enlargement is the #1 cosmetic surgery done in the United States. We have a lot of options now that we didn't have a few years ago. We can use both gel and saline implants, which are silicone gel implants, and the saline are filled with salt water. One is as safe as the other. There's been a lot of controversy over the years, but the silicone gel implant is the most studied medical implant there is, and it's been found there are no medical problems associated with it at all. About 95% of the augments that we do now are done with the gel implants.
We do a lot of breast augmentations, and a lot of those are women who've had a baby. And after you've had a baby, and everyone who's had one knows, you lose a lot of volume in your breast, and it doesn't look the same in your swimsuit or in your clothes even. And by doing an augmentation, you can just fill that back up. It looks like a more youthful breast. It doesn't look like it's a saggy ski slope type thing. And it really can boost their self-confidence, make them feel so much better about themselves.
Liposuction is probably the second most common cosmetic surgery done. There are several different types, and if people listen to advertising, they will hear all kinds of wonderful things. But essentially, the vaser liposuction, the ultrasonic liposuction, laser liposuction, and all of these other names are essentially the same thing. It's a method of liquefying the fat before it's suctioned out. And that can be done with ultrasound, which is the vaser, or a laser, which goes by several different other names. We use the ultrasound, which is the vaser liposuction. We found it works very well. It liquefies the fat. We can pull it out very nicely. It doesn't leave rippling like we used to get with the old liposuction techniques. It has less bruising, and I think the recovery time is actually a little quicker with the ultrasound than it was before we started using the ultrasound.
Majority of people can see a huge difference from liposuction or the tummy tucks immediately, but the body has to have its period of time to heal and all the swelling to go away. So I tell people that, you're going to see a huge difference in the first month or two, but even, 4 or 5 months later, you're going to continue to see a difference. And for liposuction, what you're going to do is you're going to put on some pants. You're going to go back into the winter season and put on some pants that you had on a year before and realize these fit completely different, or these don't fit. I need smaller pants.
There are a lot of different types of tummy tucks, though, or the medical name is abdominoplasty. Everybody thinks of a tummy tuck as just getting rid of the skin and fat in the front part of the tummy. However, with the advent of all of the weight loss procedures, we have people with a large amount of excess skin that not only is on the front part of the tummy, but also extends around to the sides or the flanks and actually onto the back. So the most common tummy tuck that we do now involves both the front, sides, and back. It's called an extended tummy tuck, or some people will call it a lower body lift. And this gets rid of all the extra skin on the front of the abdomen, the sides, which gets rid of that muffin top that a lot of people will have, and it takes skin off the back, which gives it a little bit of a buttock lift at the same time.
People come in saying they need a facelift, and he's like, Well, you really don't need a facelift. What you need is something to take care of the skin, to make your skin tighten, to make your skin look better, to make it look more smooth, look more youthful. And we don't realize as we get older, our faces tend to lose a lot of the luminescence. The light doesn't bounce off our face the way it did when we were younger. And there are many different things that you can do to help that, to make it look better, and one of them is laser.
We have a skincare clinic and we do a lot of facial peels, but then for the patients that have the really severe wrinkle problems, we use a laser. We use a Fraxel laser, and we also use the ultrapulse CO2 laser. The Fraxel laser is one that's in our office. It is a penetrating carbon dioxide laser, so there is about 10 days downtime with it, but it resurfaces the face. We can also resurface the neck and the chest with it to get rid of a lot of the sun damage and get rid of a lot of the wrinkles that we have. The ultrapulse CO2 laser is at Stony Point Outpatient Surgery Center. This works a little differently, can get rid of deeper wrinkles, but has about a 2-week downtime with it. But the results of both of these lasers are just spectacular. There's no other way to get rid of wrinkles to the degree that these two lasers will do it.
I mean, our goal is to make you look good, but no one's going to know that you've just visited the Advanced Plastic Surgery Center.
I came to Richmond in 1982. I was a general and vascular surgeon in Oklahoma and came to MCV at that time to do my plastic surgery. I've been in practice in Richmond doing plastic and reconstructive surgery since 1984, which gives me about 28 years here in town doing plastic surgery. I am certified by the American Board of Plastic Surgery.
We are definitely a team. And I think it's funny because many times, majority of our patients are women. And we do see quite a few men, but the majority are women. And it's funny how I'll be in the room with him and they'll say, okay, as a woman, what do you think? You know, and I can say what I think because I am a woman and I do experience these things and I do look at the wrinkles around the eyes and all those kind of things. And so I understand where they're coming from being the fact that I am a woman and I can relate to it.
Call Dr. Redman with Advanced Plastic Surgery Center today for a free consultation for liposculpture, breast enhancement, and tummy tuck procedures.